name is Max Cotterill. I am a campaign lead with the California Nurses Association, National Nurses United. I work on our campaigns to pass single-payer healthcare, both in California and Medicare for All nationally. And I want to say thank you to Healthcare Now for hosting the annual Medicare for All Strategy Conference. And hello to everyone tuning in from across the country. I'm here to give you a brief update on the movement for the California Guaranteed Healthcare for All Act, which is also commonly known as CalCare, as well as what comes next in that fight. For those of you who don't know, CalCare is a proposal that would enact a comprehensive framework of governance, benefits, program standards, and healthcare cost controls for a single-payer healthcare coverage system here in California. And passing this policy framework would allow California to begin consolidating existing healthcare programs, obtain necessary federal waivers, and determine public financing. And this bill was reintroduced into the California Assembly as Assembly Bill 2200 in February of this year with 18 co-authors. Unfortunately, if you have not heard, after the bill moved successfully through the Assembly Health Committee, CalCare was held in the Assembly Appropriations Committee on May 16th. Which means that it is blocked from further legislative action for the remainder of the year. And this is deeply frustrating and enraging, particularly because the Appropriations Committee is a secretive, behind closed doors part of the legislative process. With the Appropriations Committee, there is no public vote. Legislators on the committee vote privately before the hearing, and then in the public suspense file hearing, the fate of hundreds of bills are announced one after another. And so last Thursday, we all heard that AB 2200 was called during this marathon-long suspense file hearing, and it was announced that they were holding it in committee. And again, this means that CalCare was blocked from advancing to the floor for a full vote. And as I said earlier, it means that any further legislative action on it is no longer possible for the remainder of this year. And this is truly an outrage, especially when our likelihood of winning a full floor vote in the Assembly was looking very, very good. And so coming out of that, we need to start by getting some answers from our legislators and hold them accountable. We have a chair in appropriations, a speaker of the Assembly, and a governor that all claim to support single-payer healthcare. So how can it be that a bill to do just that was quietly blocked in the Appropriations Committee? The buck has got to stop with these leaders who claim to support single payer. And during this latest push for AB 2200, we built a mighty coalition of more than 250 organizations across the state of California, including some of the largest unions in the state. These are unions such as the California Teachers Association, California School Employees Association, California Faculty Association, Unite Here Local 11, California Federation of Teachers, United Auto Workers, Region 6, and many more. And collectively, these unions represent over 1 million union workers in the state. And in addition to their endorsement, we also earned the endorsement of the California Labor Federation, which represents the state's 2.3 million union workers. And we have no intention of stopping that work. We are only going to continue deepening our labor support for this bill, working with our allies, bringing in new organizations into this fight. But nurses cannot do this alone. This is a transformative change that is going to take all of us to achieve. And we knew last year that we needed to build an even larger and stronger grassroots movement for this reform. And so we didn't waste any time doing that. We made that a core focus of the campaign. And together we organized over 100 Canvas events last summer, collecting more than 35,000 petition signatures in support of CalCare. We held a huge day of action in September with a dozen CalCare teach-in events across the state. And then this past March, we had another huge weekend of action with 26 CalCare house parties all across the state, from Sacramento to Salinas to San Diego. And at these house parties, nurses and activists planned another 50 crowd canvas and business canvas events that just took place this past April last month. And so we in addition to these steps, in addition to our labor outreach, our grassroots campaign, we also knew that we needed to organize more effectively within the legislature. So last summer, we held 4 town halls in San Jose, Oakland, Santa Rosa, and Los Angeles. And these town halls featured panels of assembly members and state senators talking about the need for CalCare in their districts. We got a whopping 92 elected officials and candidates across the state to take our CalCare pledge, which commits them to doing everything possible from their position to help pass CalCare. And when AB 2200 was introduced earlier this year, our CalCare district leaders held dozens of lobby visits with their assembly members to make sure that they knew about the new CalCare bill and were ready to support it. So all of this led up to a successful health committee hearing back in April. Before the hearing, on the same day of the hearing, we held a rally in Sacramento with speakers from some of our strongest organizational allies. And then in the hearing, legislators heard powerful testimony from CNA President Michelle Gutierrez-Vo, as well as Oakland Education Association President Ishmael Armendariz, also representing the California Teachers Association. And at the end of that hearing, the Health Committee Chair, Mia Bonta, actually requested to be added as a co-author to the bill. And so we had a lot of momentum going into the Appropriations Committee. And so that's part of the reason we were so disappointed that we learned that the bill was being held in appropriations. And I think coming out of this setback, we need to take some time to regroup and figure out the next steps. We don't want to rush into action. We want to be thoughtful and strategic with how we move forward. And that involves having an honest look at what happened. It involves looking at where the campaign was strong and where we can do better. And part of that will be reflection. A lot of that will be continued debriefing with all of our supporters and all of our allies in this fight. But we are in this fight for the long haul. CNA has fought for decades to ensure that healthcare is a human right for all patients, regardless of ability to pay, and we have no plans of stopping now. This is our life's work. Legislators say that they support single payer, but they do not back it up with action. And so it's our job to make them.